Good morning, good afternoon, good evening, my fellow YouTubers, Facebookians. Welcome to another edition of Rita's video blog. Yes, that's right. This bed is messed up because I was taking a nap. Now, I'm not wearing makeup today because I figured you're going to see me in my natural form, So, went to my consultation, and the doctor
before
talked...
your transformation into a succubus. Sorry, I had to throw that in there.
Anyways, my point is we... First of all, let's just talk about the consultation for all of you watching this, subscribing, etc. First of all, the doctor pulled out a book and he was going over it, and I didn't have many questions. I was listening to what was going on, and what they had. We talked about memory gel implants. We talked about saline implants and gummy bear implants. Now, what you're going to find that's interesting with the doctor is, first thing he said is with breast tissue is most transgendered people usually need, unless they have a lot of breast growth, extenders. That's the first thing he said. Well, at first I was sitting there in the chair going, praying, no, 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 no. I don't need extenders. But finally, after the consultation went for 45 minutes, which he was doing this no cost, which he was blatantly honest. He said, everything you put in your body is man-made, will fail. And he explained details, and I listened. And then...
Well, like the saline, 1% per year.
Yes, anyways...
It increases per year, so...
I think, Aaron...
chance of failure, 10 years, 10% chance.
I think what we're going to do is, Aaron is going to do a video on my behalf when I'm having surgery to explain what the doctor said in the percentage, but I will be...
Oh, no, you could do that. I was just giving you a reminder.
Anyways, the saline implants, apparently every year it increases like 1% leak rate, and so...
Silicone is 1% every 3 years.
And silicone is like 1% every 3 years.
And the gummy bear will crack, but they won't leak.
Yeah. And eventually the gummy bear could crack and won't leak, so you gotta be careful, because the doctor said, that's why they recommended replacing them every 7 to 15 years, so...
Then the scarring that goes around it is called casing.
Yeah, exactly. And the scarring around it will be a casing.
All stays within the casing because it's just a major scar.
So, anyways, I wanted to share that with you all. Basically, the surgery is set for between 12 and 2 o'clock on Thursday, so, once that's done, I got some time to relax. Tomorrow, I have to contact the clinic because I want to double check on the times and double check what they need, because if they want me to trek up there, I'll trek up there 1.2 miles one way and 1.2 miles back. And I can do it in good time. That's why we chose this particular location. The doctor, on the other hand, was very funny because he asked, basically, and I told him, I found him through this site, but apparently he doesn't do many transgender patients, so he's looking forward to doing this anyway for experience. But anyways, so they will try running it through my insurance. I'll probably be the only one, but in the end, when I was praying to the Almighty about it, and Jesus, he took a look at these and he says, oh, you have so much tissue, I can probably get into a 550cc implant. So he's, he was more so, as he was talking to me and Aaron, the gummy bear one was the one he was looking more so. The other two implants, I think he had to put extenders in it. But the way he said what he said, I think...
it looked more natural for you to go with the gummy
bear. Yeah, exactly. He said also the gummy bears will look more natural. So, and we talked about transgendered women.
speaking of the gummy bears, he says that you can't go through the armpit or the areola for it. You have to go under.
Yeah, exactly.
So you get a bigger scar.
Well, exactly. So as Aaron was just saying, they can't put it under the armpit or the areola, so they got to do under, which the doctor knows what he's going to be doing. It's all lined up, so we're just going to be going ahead with this procedure, and it's all set. That's why we came down to where we're at. We're not giving details yet. In the meantime, I do want to say I will do a quick video update to this channel of my travel exploits, and I'm sorry I'm not wearing makeup. I'm also sorry if you saw me blow my nose into this. It has just been hectic the last 2 days of allergies, and they say it's tree pollen and stuff like that. So, with that said, everyone, please stay tuned for another video as I get closer.
Well, that's also your before and after, so...
Oh, yes, you will be getting, probably my next video will be an after video. So, with that said, everyone...
Probably right after, though.
Exactly. And Aaron will be looking me over. Oh, and apparently Miss Annie says I am fake. So, she's angry I'm getting him done. I think it's jealousy, but... There you have it. Please add and subscribe. Please post comments, leave feedback, suggestions. Thank you. And may God bless you all in everything you do. Good morning, good afternoon, good evening. Aaron, what's the topic of this video?
This is part 2 of your before and after.
Before and after breast augmentation part 2. Please excuse me. I am also trying to slowly take my pants off so you guys don't have to see it. I just came in from a walk.
Oh, careful there.
And I got to be very careful because right here, if you can see, I have drainage bags for blood. Now, for all of you...
And they caught on her button.
So, first of all, you're going to probably ask, or Aaron, since you know better questions right now, since I'm so fluffy...
Yeah, the meds are still kicking her butt, to be honest. Careful. There you go.
So this is what it is. As you can see, there's
still bandages,
but I'm doing the best I can in this little top. I will.
And then she's got those bags currently, which are for
drainage.
Yep. They're supposed to drain fluid off. Got gummy bear implants.
Yes, I went with the gummy bear.
470 cc's.
Yes, which doesn't compute to what bra size I will have.
There are a lot of people asking that. You will not know until you're able to get measured for a bra.
There's a brochure out there the doctors give. One of the leading implant manufacturers is Mentor.
They can estimate.
And Mentor basically says cc's don't equate into bra sizes.
So just because you got a very large implant doesn't mean you're going to end up having a very large breast. Because the breast is only part of the bra size, so and it doesn't just become a cup. The way the doctor tried to explain it is that, you know, the amount of cc difference between one and the other is minimal. You barely notice it between the two sizes for each step up. So, anyways, won't find that out until she's healed enough, and she'll be wearing sports bras for 3 months, roughly.
Which, a lot of girls, as me and the doctor was talking, a lot of these girls out there that are trans girls, and genetics, I'm going to both put them all on the table for this stereotypical report, right?
Mm-hmm.
That states that they go out and they buy
underwire
bras right away, and it's like...
And there's a real problem doing that if you have yours done bilateral, which if you get gummy bears, it has to be done bilateral, which means they're cutting under. And when they do that, you wear that underwire, you're putting it up against a wound that's still trying to heal, and you slow the healing process. So they don't want you to do that. The other problem is that in time, these will start to slip down a bit.
Yes,
and they want them to drop to the position they should be in. But until they've healed enough to do that,
You're not supposed to.
You're not supposed to wear an underwire because you'll make them heal funny.
Yeah, exactly. So
you can make them misshapen that way.
Exactly. So with me,
and there's too many trans girls who just run off immediately and get the first bra they can, and it's like, oh, my first bra, with my boobs, and it's like, don't do that quite yet. Take your time.
So
do it right.
Shall I go into the details?
You need to talk about your pain, discomfort,
and the story of what happened all the way up to
your surgery.
So first of all, I'm not telling you where I went. That's none of your business. They ran my insurance. We'll know.
Well, they can watch a lot in your travel log, days 3 and 4, because 4 covers your surgery. But you can do.
I'll do a quick video. So I got up yesterday morning. After not getting sleep, I was panicked, worried, because when you're a trans woman and your first virgin surgery, you don't know what to expect.
It's not really even that. It's just you're going to go through anxiety because you're going to have surgery the next day.
Yes, but
I've had foot surgery twice, and both times I've had it, I've been anxious.
Yes, but here's the thing. Picture a woman like myself, no medical problems, no surgeries pretty much to speak of. You're going in for your first one. You don't know what to expect pain-wise.
Well, that gives more anxiety, too. But, yeah, you got anxiety just because you're doing it.
Exactly. So the next morning, I was groggy. I was tired. I told Aaron more likely I will be sleeping. So
and you weren't sleeping when you came home.
No, let me just explain. You
have to sleep on your back. And the discomfort is enough that you want to toss and turn, and you don't know what you're doing exactly, and it's hard to fall asleep. So, and then you want to worry about your pain management, which they're like very specific. You can't take your pills any sooner than this, and you got to wait. But you want to take those pills because you don't want to hurt.
Anyway, so I finally went upstairs. I filled out the last piece of that paper. They said to be there an hour early. We're like, what the hell? So finally, afterwards, we go downstairs, and we met another, I believe she was Filipino, yet again. A lot of Filipinos that I've met in the last, but you know me, I love Filipinos, including Annie. So we got into the room, and Aaron says, wow, this is one...
a real nice room, kind of a luxury room. I thought it was like a day spa.
Exactly, and they got me all prepped. They said, do this, do that, make sure you do that. That's why I got some iodine marks still. I got to scrub slowly.
Yeah, because you can only take a sponge bath now with a damp rag. You can't have a wet rag. So that means if you get soap on you, how do you get it all off with just damp rags?
Exactly. So
it could take forever. So
anyway, so they got everything prepped for me. The doctor came in. He asked me one question about medicine. And apparently they had the medication set up for after surgery. That's when Aaron went over to get him, and they gave me an anti-nausea, but it was more money because of chemotherapy. But anyways, so what happened is finally they were ready, and there's only one thing here and I'm going to use her name because I can. She's a fellow trans sister. As Brooklyn Beauty would say, story time. And I will give you the story time here because I don't want to go and do a second video. But a guy named Todd, a medical assistant for the doctor, kept referring to me as him. And the anesthesiologist in my room was talking to me as she this and she that. But when they were there, it was all...
Yeah, when one nurse kept referring to Rita with him, he, is, etc. The anesthesiologist thought they were doing it wrong, so they changed and started doing it the way that they thought was right because they thought the nurse was right.
But everyone else apparently in the room threw a fit. Then next thing you know, the anesthesia...
Then you pretty much woke up, and they were gone. So
I woke up, and the only one I was in a room was with this woman who was talking to me, trying to get me to come out of it, and I was talking about Baby Moppy being my little mascot on this trip, which he's been a sweetheart. She wanted to meet them, and every time I turned around, she said, how are you feeling? I said, discomfort. She's like, oh, well, we got this med. A few minutes later, how are you feeling? Discomfort, because when I woke up, I was in severe pain. So she just says, we're going to keep you medicated as long as you fit these time frames in and slots. Set your alarm for waking up from naps and stuff. You'll be right on it, and you'll be good till you see the doctor. He might tell you to run over to the pharmacy before you leave. So when you get home, you can do your management with your primary care physician. But in the meantime, we're going to get you around-the-clock medication. This is very important. And I was like, okay. So as soon as, the discomfort, I was like, still discomforted. Well, let's give you another one. And I didn't feel anything. Finally, I was in the waiting room, and Aaron says, hey, hon, you know what happened? I said, what? Well, I know the lady was going to help you, and you can have food or water, and I didn't know what they meant because I was out of it going into surgery. They offered me food. They offered me water when I got out. They gave me a couple crackers because I needed something with the pills because before I left, these meds that they gave and the injection, as Aaron knows, is fast-acting. So they might give me an injection that might be like medicine like this, for example, but it's fast-acting. An hour or two will wear off. So they gave me some Percocet and sent me on my way.
Yep, now you go back on Monday to have the tubes removed and
bandage.
The bandage removed and follow-up, and then you're sent on your way home.
So. And Tuesday I go home, and I will give you an update on Tuesday on the
only thing that she's run across that's different is her fascia's been flushed, and it's not doesn't seem to be a problem, and it seems to be better right now. But it looked like she had sunburn on her cheeks and nose.
Well, we did have I did get suntanned a bit from that day we walked at the 90 degrees.
Yeah, well, this wasn't that. This was what's called flushing.
Anyways. Another story for you all as I go back Monday. As soon as I go back, some of you are going to sit there and say, oh, it's not bad. Some girls go to Thailand. Some girls go through wherever. And go ahead.
You might want to ask, this is probably more important, and you can drop what you were saying. You might ask why this is part of the now, before and after. Because this is the middle part. A before and after isn't just a before and after, but a middle as well. So this is essentially the midsection of the before and after. So I think that's enough for this video because you are splicing several together. Let's not make it several
I do
hours.
want to make something important, and it's already going to be like 50. Oh no, that was the travel days.
Yes.
Anyways, what I wanted to say to you all is, besides being discomforted, I do have something to say about the management, and some of you could sit there and say, oh, it's not bad when I had it done in Thailand or wherever you did it. But some people get a hospital setting, and when they get a hospital setting where they're there, the hospital gets to maintain everything for you. But when you go to an outpatient clinic, you have to have, they definitely want you to have someone there to guide you, like this cutie
because the medications and stuff that you're under, they're afraid you're a fall risk and everything else, even if you're young. You can become loopy, might end up with a fever with delirium and not know it.
Exactly. And second,
so they want someone around you to keep an eye on you.
Exactly. And the second thing is some people say, and I can contest to this, being a post-operative breast-augmented transsexual woman, is that you're going to feel a little icky and a little dirty and, annoyed because you can't shower. Just remember, in a few days after your surgery, once you're past the, bandages, and Aaron forgot to mention a key thing. I don't know if all girls get this, but I've only known a couple transgendered women out there. One go out into Thailand. Remember I told you she lost her breasts because of the things and all this stuff and whatever.
Right.
But some girls don't need the drip.
In fact, they have multiple ways of installing the breast implants, and what the gummy bears are textured on the outside. And because of the texturing, they don't slip and slide around, and they don't move inside. So they want to make sure that the fluids get drained off so that the implants don't shift and become in the wrong position. And don't play.
I was just showing like this around, I'm not touching the shirt.
Right. So they want to make sure that they don't shift. In fact, at this point, it looks like your right is a little lower than your left, but we'll see how it works out.
Could be the bandage,
It could be the bandage.
The bandage has been shifting, so we'll find out soon enough.
Besides, most girls are lopsided somewhat anyway, so that's not a big deal.
Well, we'll find out.
In fact,
the doctor,
it's more natural.
One
like
of the
that.
things the doctor asked me in the room was, "What's the main two features?" I said I want them to be even. He
And
said once they drop.
Natural.
Second was natural, which, by the way, we should talk about breast size for a second.
She originally wanted to go with the 550cc, but gave it up to the doctor to make the final decision in the end because I thought she should go with, like, I think it was the 400cc, and it might have been the 450. Anyways,
no, you wanted the 350.
I don't know. It was higher than that.
No, you said 350. Doctor said we can go up higher, and I, of course, in the consultation, getting prepared for these, thought he was going to give him the implants.
Anyways, he tested out various sizes, asked the nursing staff what they thought, and they went with the one that everybody thought looked best.
Which means they actually had multiple implants ready to be going in the OR as
they used a sizer. But they did have multiple so that they could just put in
exactly. They had the right sizer. They checked everything out.
Which is interesting that they said they had to order them, but if they had so many sizes, I guarantee they didn't order that many sizes. They probably had it on hand.
Exactly, because of it. So
they may not have had the 550 on hand, and they may have had to order a 550, but
the doctor put in, just so you all know, 470cc. So that doesn't equate to cup size, but as the doctor said, that was the first question I asked. Aaron the doctor did like my sense of humor when he was getting ready to put me under. He says, the joke was, your husband Aaron must like logic.
Yes.
Because I said, well, he's the one who uses logic. I don't. He said, well, most women don't. He said, most women are loose cannons. He says, I bet you're a loose cannon. Next thing you know, I was out of it. But he ran in because he was doing multiple surgeries that day. So because of it, he dotted me up, told me not to worry, And let me just tell you, the room I was in had its own TV. It had its own space-age heater blanket.
And something I thought was very odd about the marker. When we were in the room, I was noticing there's this little purple thing about this long that was sitting on the table, and it was in plastic like a needle. And I'm like, what's that, I wonder? Anyways, when the doctor comes in and getting ready to mark her up, he opens that, tears it open, and then he proceeds to mark with it. And it's just a marker. But when he was done marking with it, he put the cap on and put it in the biohazard box. It's like a one-time use marker. I almost thought that was a waste. Why can't he just use a regular magic marker or a Sharpie or something? Does it have to be this special certain thing that they can only use once and throw out?
Also, the nurses, for example, because, this is the before and after, and I got to splice them together, they tried to take good care of Aaron, too. Not just thinking, oh, he's a companion, but they tried to take care of him as extended family, as well as Moppy. So most hospitals...
I mean, I didn't get any Coke or anything, but
yeah,
I was allowed to come and go.
Lady said you could have asked and they would have given you one, but more likely it would have went into me. So, but
and it looks like you stopped bleeding because it looks like you're clotting in the one tube, which I got to strip in a few.
Anyways,
stripping the tubes. You have to take the tube and squeeze, and you have to move your fingers so that you can actually hold it. Because you don't want to accidentally pull it out, but you've got a little clot, it looks like, going on one side. So that means no blood's been going through it for a while.
Anyways, with that said, everyone, I just wanted to say, there you have it. So if you think everything is BS, and by the way, before we go, I'm not going to give names, but there's a woman out there that said she's had facial work done, breast work done, and vaginal work done in 4 months.
Well, the confusing thing is that she came out as transgendered 4 months ago. She wasn't on hormones or anything. And then all of a sudden, she's got all of her surgeries, and everything's great for her. That's obviously fake. I mean, for one, anybody who's transgendered knows that you have to have your referrals all in order. I guess she could have gone to a quack in the box, but she doesn't look like she's gone to a quack in the box. She looks almost genetic. So I have a feeling that what she did was she took pictures of her boyfriend in drag, said it was her, looked similar enough because of the makeup and the clothes and all that, same car, and then she started taking pictures of herself saying that, well, this is what I look like now. And so, fake before and after that way. Anyways,
I just wanted to say for a lot of you out there, I'm just happy, you know, and the medication they got me on will manage everything. You know, I also want to say look for my videos on the travel blogs of how well it goes for leaving this wonderful city, which is wonderful because I've had no trouble so far. I was
Anyways.
afraid. So, please add and subscribe. Please post comments, leave feedback, suggestions. Thank you. And may God bless you in everything you do.
And stay tuned to the final part, which is the after.
Good morning, good afternoon, good evening, my fellow YouTubers, Facebook, and welcome to my office. As you can see, I got this desk pretty much clean. This one, I have to juggle things around because, well, Mr. Aaron decided to put a box in here and he won't move it. So, I will have to get on him on it. So, this is before and after part 3. Now, as you've seen in the first 2, the second video was in between, just saying surgery was done. Let me tell you, first of all, the pain was brutal. I mean, the pain was super brutal. And talking about pain and super brutal and other stuff and etc., I think I'm going to do a video soon for you all. But first, I want to share... Let's see, can I do this without you seeing my name? Yes, I can. This is, if you can see it, this is the bill. It's almost $26,000 for these breasts. Aaron and I saw the statement yesterday, so I got my hair dyed yet again. So anyways, $26,000. For some of you wondering, what are these? These are the new gummy bear implants, alright? I've been told to bind them and let them drop. They're dropping nicely because I'm binding them while I sleep. I bind them for about 12 hours a day, and the rest of the time I wear clothes like this to let these puppies breathe. Now, when I was getting fitted for a bra, sports bra, couldn't wear anything that's underwire because of it. The doctor has said not to wear a bra for 3 months. It can make it so the breasts don't drop. So, anyways, what has happened is I'm working on them all the time like this, pushing them down, etc., giving myself some breast massages. It's working itself down. As you can see, I got a light pimple here. I'm not happy. I popped it, and I'm waiting for it to clear up. So, $26,000. And by the way, before you ask any questions, the new gummy bear implants were over $11,000. Let's just say $11,500 for these babies. Not including all the other services that went along with in a hospital setting to get it done. So, so you got $11,500, and then you got almost $13,500, $14,500 for extra stuff that they tacked on for approximately a 2 to 3 hour surgery after the doctor couldn't get decided that the 550cc implants did not look good for me. Basically, he went with 470cc implants. And just so you know, 470cc, my breasts are from Natrel. Yeah, Natrel. Now, how I know this is simple, it says right there on there, it says right there, each implant is 477 cc's. And, serial number, which they're in me, so you guys can't carve them out. So, that is an identification in case something happens to me, but you get the point. So, 470cc implants, and, well, this is what you get. I'm still working on it. Aaron got me the shirt. Let me just say, before I was stacking my bras to 10, and it was a pain. It left me a mark in my back, which I'm still healing from. And then some people would just drive by and be like, oh, look at her. But truth of the matter is, lately, when I've gone to town, whether it be grocery shopping, personal shopping, shopping with Aaron, walking to catch a bus, we've had nothing but about 90% of the men and women were checking me out. So, and by the way, once you get a pair of breast implants like I got, that tells you right there, this chick cannot use the men's bathroom. You don't walk in with a shirt like this with your breasts, in this. So, by the way, the shirt is a little lower because I lowered it for the video so you could see where everything is. So, Aaron, am I missing something?
No, sounds good. I mean, how do they feel? They feel
they feel and look natural, which I really wanted 550s, and Aaron thought 350s would go good. And then the doctor tried to get me to go with 450s. Instead, he decided with all his staff members to go with 470, which 470 is not bad. I don't know what the cup size is, as CCs don't determine bra size or cup size. But when I tried on the sports bra, the lady ran me to 34 around. However, Aaron and her debated and decided to try to put me in a 38, and the 38, and it fits perfect. So more likely I'm a 38. What I am on the top, I don't know, but these babies are working to work itself down. It takes a while. I got 3 months to get these babies to drop. I have 3 months for my insurance to get back with approved or denied before I appeal it. But as I showed you right there, and all these little extras. By the way, when you go for surgery, make sure you ask them if there's any hidden fees, because they didn't tell me. They said it's $7,000 out the door, $7,085 out the door. This came to almost $26,000. I rounded it to $26,000 because $9 difference. Big deal, With interest and everything else going on, it will be a very expensive procedure. So proceed with caution if you're going to bill it under a insurance. What else can I say? Oh, and the other thing is if you're having surgery, whether it's breasts, face, vaginoplasty, phalloplasty, breast removal, hysterectomy, any transgender-related surgeries, just remember, transportation costs are usually not covered, so you're paying more. So, but how do I feel? I feel confident. I was telling the bus driver this, and the bus driver tried to defend me, not defend me, but basically belittle me and tell me, whatever, and it's like, second thing I want to say is, besides being more confident, I don't think about people looking at me anymore like, what am I? I just walk along. I'm wearing shirts like this. It's the summertime. I got swimsuit tops that I can wear that I'm planning to wear out. It's just a very, 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 very beautiful thing, and, no trouble with anyone, So yes, and when they drop, they'll probably produce more deep plunging cleavage. That's what I've been told. So, right now this is my cleavage right here. Unless I want to push them together like this, and then, they'll have more of a deep plunging cleavage. But they probably won't look good pushed together. But the other thing I should talk about, Aaron's probably going to tell me to do, I forgot it, right?
I don't know.
Is how do they feel in general? These things feel like natural breasts. I mean, yes, you can sit there and squeeze them and feel them and everything, but they feel like they're part of your body. You don't even know they're there, It's like sitting in a pocket. They're implants, but to everyone else, they'll just think, that these are, flesh bags, for feeding babies, so, or whatever, so, so, the pain unless you want to get through it, and a lot of trans women apparently are having the insurance go through. They could tell you differently on pain, but a lot of these transgendered girls who's on insurance like Medicare, Medicaid, will not talk about it. They just don't want people to know. And that is where there is a problem. You know, me, I'm willing to share it. So, also, having these has boosted my confidence, and it has also made the Walmart girl basically there that sized me up. I've known her for years, being like, yo, girl, time to show those babies off, those girls off. Yes, yes, and yes. So, with that said, everyone, I just wanted to share that with you all, and you know, the pain is subsiding. I still got swollen up here. They're still swollen up here, but eventually, with the medication and rest properly, they will start to less swell up and just drop naturally. So, and the last thing I should say is, since I'm at home and I am resting up and trying to recuperate, which doctor said 8 months, or not 8 months, 8 weeks, 2 months. I have a severe sensitivity on the nipples that makes me pretty much orgasm, also known as, in my opinion, pure ecstasy. So I think I was blessed well. So, anyways, so that is it for this video, and I am 15 days post-operative with these babies, so I hope in time my videos will help out some of you on your transitional path. And so, please add and subscribe, please post comments, leave feedback, suggestions, thank you, and may God bless you in everything you do.